chest rise and check for pulse at the same time. And open the airway. So it's gonna look like this. If you get down here, you can see the chest rise. And you can feel for the pulse at the same time. At least 5 seconds, no more than 10. So if there's no chest rise and no pulse, what are we doing? CPR, right? Simple, right? So that's how it goes. It goes like this, right? I need help, call 911, you get an AED. I'm looking for chest rise, checking for pulse. No pulse, no chest rise, I'm gonna start my chest compressions. Got it? If everybody gets that part down, we're good. We can go home. No. That's how it goes. Now these guys light up 2 green, means you're doing good chest compressions. If it's 1 green, it's going too slow. If you have a flashing yellow, it means you're going too fast. Going to chest compressions, 30 to 2. 30 compressions, 2 breaths. I always do nose to nose cone. I tell myself that in the head. And there's a couple ways you can do this. If you're on the side, you're still gonna use the C method. You're just gonna be more towards the front. More towards the front of it. And then use this hand to pinch the chin and the bottom of the mask. That's gonna give you a good seal. But always remember, go to the bridge of the nose, then roll this down. You get a way better seal. If you come up and you just try to place it, it's not gonna work as good. Go to the nose, then lay it down. If there's 2 people, you can go easily, a lot easier, behind the head. And you do the CE method, right? See how it makes a C and an E, right? So the C goes on top this way. The E goes under the jaw. Tilt the head back. So you could be back here, bagging. Make sure that you don't do the full bag, right? If we build too much pressure in this chest wall cavity, what's all in that chest? The heart, the lungs. Also the vena cava, the largest vessel that carries blood away from the heart. So if we build all this pressure up in there, it's not needed, it's like putting pressure on a water hose, right? We're only getting 30% of the heart if we do the best chest compressions. And now we're putting too much pressure in the chest. And it's like diminishing venous return to the heart, like putting pressure on that little vein there. It's the largest vein in the body. What if the person does have a pulse, right? But he's not breathing. What are we gonna do? It's rescue breathing. We're gonna breathe for him 1 breath every 6 seconds. So you would just count 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, breathe, right? We're gonna take over his breathing for him. If you bag too fast, it hyperventilates him and it constricts the blood vessels to the brain. Again, the brain takes 25% of the body's oxygen, and we need that oxygen. So with infants or pediatrics, it's gonna be 1 breath every 2 to 3 seconds. Tap them on the clavicles, no sternal rubs, okay? Cops do that. They buy special gloves just to get them freaking drug addicts. We're gonna show them. We're not doing that. We're just checking to see if they're responsive. Go on the clavicles, be loud. Help, help, I need help, AU, call 911, AU, grab the AED. Check for pulse. Look for chest rise. No pulse, no chest rise, you start compressions. If there is a pulse and he's not breathing, we're gonna breathe for him. And you can do it either way, right? You can breathe for him this way. You can breathe with a bag valve mask. You can go mouth to mouth. If we're going mouth to mouth, what do? We pinch the nose, right? Make sure you tilt the head back. That tongue is large and causes obstruction. Tilt the head, get it out of the way. That's what happens. Pediatric, say a child, you're gonna do the same thing. Pinch the nose, tilt the head back. But with an infant, we're gonna change it up on mouth to mouth. When we go mouth to mouth on a child, it's over the nose and the mouth, okay? We're gonna practice, we're gonna use the face masks and we'll use the bag valve masks. This is a little bit harder. But in general, I don't know what you guys have in your office. I don't know if you have masks in your AED kit or with your AED kit, or I don't know what you guys carry, but this is a good way to go, right? I mean, if you're on the street, you have to go mouth to mouth, I would do it. I've never had to, I always have equipment with me, but I would do it. So when we do compressions, we're gonna do 30 and 2, but how long? We're gonna go for 2 minutes. We're gonna do 5 cycles, right? 5 times. Or that's our goal. But if they bring the AED over, we're gonna hurry and throw the AED on them. We don't stop compressions when we put the AED on though, right? We work around the guy that's doing compressions. We never stop compressions. I'm not like, hey man, get out of the way, I gotta put this on. No, we're doing compressions, you come secondary. But get the AED as soon as possible. What's the first thing we do? Turn it on. That's usually a test question. Just follow the prompts, right?
If the patient is a child, press the
It's just going to tell you to put the stickers on. So you look at the stickers, right? Turn it on, put the stickers on it. Don't put it on a clavicle or a bone. It goes on muscle tissue. You're going to put one up by the chest over here, and you're going to put one down here on the abdomen. Make sure whoever's doing chest compressions is counting out loud. I don't care if you count from 1, but once you get to like 20, start counting so everybody knows. That way you can, even when you're putting the pads on, you know. If I'm here doing chest compressions, it's kind of hard to put this one on where my hands are. He can come over behind me though and easily stick it behind me. Or if I'm on 26, put this one on first. We'll be on airway and you can land that one. You know what I mean? Just kind of think about it. And so the number one thing I would say in cardiac arrest or an event where you're helping is tell yourself it's not my emergency, right? It's not mine, it's his. Stay cool, calm, collected. If someone gets excited and they're just going crazy, you should be chilling over here, you know? You should be over here chilling, sitting on the floor, you know, or whatever, just bagging. You know what I mean? You know what you're doing. Don't get excited. Don't get it so ready. When you do that, it spreads to everybody on the team, okay? When someone does that on my team, I tell them, hey, go get some information from the family. I get them out of there, right? But all I know is this guy is dead and he needs us to be his advocate. He can't, he's dead. So if somebody is not doing a job correctly, if you noticed once you leave today and you are in a cardiac arrest with somebody and you're helping out, you be the team leader, right? You be the one that stands up. And if you see someone else doing compressions and they're not good, they're not deep, they're not fast, and they're not hard, you say something, right? You don't have to be a jerk, but just let them know, right? Let them know. That's this guy's life. What was your brother, your dad, right? So I just share that with you. I know you guys have had this class forever, but I want you guys to be confident, right? That's the whole thing. You could have this class 10 times, and I don't know if you're confident. I don't even know who instructed you before me, but when you leave today, I want you guys to feel confident. And being able to save someone's life is an awesome feeling. It's going to tell you, and once you turn it on and put the pads on, it's going to tell you to analyze. Don't touch the patient because it'll analyze your heart rhythm. We want to get the patient's heart rhythm. So I want you to analyze the patient's heart rhythm. Don't touch them. When you're not touching them, you're going to say stay clear, right? When it's going to tell you, hey, we're ready to defibrillate, it'll say, it'll tell you that it's charging, it'll tell you to defibrillate. That's when you say stay clear. We don't want to shock your partner, right? This is staying clear, hovering over the chest, remember? What do we do as soon as we hit that red button and defibrillate? Chest compressions. That's it, we're done with the AED. It stays on and it'll tell us again when to analyze. We're just over here doing compressions, doing airway, that's it, right? So it only takes a few seconds to put the AED on and then we're done with it. When we're doing pediatrics, you put one on the front, one on the back, right? Just like on the picture. And there's a button right here on the pediatric button you push. And this thing will just guide you through it. If you're nervous about it, just listen to the prompts. It'll tell you what to do.
Hey, blue on black, tears on a river, push on a shove, it don't mean much. Joker on Jack, match on a fire, cold.
Imagine living your life with, you know, one side of your face drooping, slurred speech, your left arm doesn't work, your left leg doesn't work, horrible, right? And all the time I would get these people, a lot of old people, you know, especially men, they don't want to go to the hospital, right? We don't want to go, man. I don't want to go. Being a medic, I never wanted to go to the ER. But if you ever suspect somebody, usually they have like a mentation issue, they seem kind of off too. But you can do that test. Just do the arm drift test, right? Ask them, you know, to say that, repeat that sentence, you know. You can't teach an old dog new tricks, and do the grit test. And immediately you get them help. They should be flown out. You need to go not only to the regular ER, they need to go to a stroke center. So that's basically really, sad for me running on so many people with strokes and so many people that wouldn't go to the hospital. And so you can also have a transient ischemic attack. They call it a TIA. And you'll have all these symptoms, right? Whole left side not working, facial droop, arm drift, you just got it all, right? You can't speak. And it'll go away within like 24 to 48 hours and you're perfectly fine. Make sure you know how to do the Cincinnati stroke scale. It's pretty simple, right? Do the arm drift. Remember, palms up, have them close their eyes. And they'll be like this, one arm up, you know? and have them repeat that. You can have them say anything, but they say that just because everybody uses it, and it's a little bit difficult to say. And do the grip test, right? And you can also look at your pupils. And if one pupil's blown, then it's bad. And it's usually the opposite side that's damaged. So if your left side's blown, it's the right side that has the injury.